Hello, good evening everyone. Welcome to the webinar on Choose to Challenge Cancer on the occasion of International Women's Day organized by Sanjeevani-Life Beyond Cancer, sponsored by LIC of India and co-sponsored by 𝗪𝗪𝗏 and Samda Logistics. Today we have with us some eminent women against cancer as the esteemed speakers for the event. It is really an honor to have you all with us today. We are looking forward to a great learning session ahead. So the next speaker among with us today is Dr. Suparna Mazumdar.
A very good evening to all of us gathered here today on this wonderful opportunity which has been awarded to us women, the International Women's Day, which is recognized on the 8th of March. A little bit on the history of this day, that this was recognized from the year 1917, the day when Russian women gained the right to vote in public. And that was the gender equality, that a woman can also, and that's not that long ago considering, it's just about 100 odd years ago, that we gained the right to vote in public, and that started in Russia in 1917. And from 1977, this day was recognized by the United Nations as the International Women's Day. And I know there is a lot going on talking about gender equality and gender parity and empowerment of women. And we women, we have to be strong and we have to realize our power. And unless we realize ourselves of what we are capable of and that we are in no way less to the men around us, that will be the day when we will really say that, yes, this is the International Women's Day. And I am sure that all of us, we've gone through 1 year of COVID-related, pandemic-related restrictions, and that has been a bad year. I don't think any of us expected to go through and live through a pandemic. And one good point, a takeaway from the COVID-related restrictions, I feel, is that we have realized the importance of self-hygiene, cleanliness all around us, not only our own selves, but all around us. Wearing of masks, mandatory. I would recommend that we should continue to wear masks wherever possible. To do our own tasks, to be self-reliant on a lot of things which we never thought we would have to do ourselves. This 1 year has taught us that no, we are in no way less than the others and we can do a lot of things which we never thought we could do. To avoid gathering unnecessarily in public, to avoid unnecessary travel, to have a healthy lifestyle and simple diet. Now coming on forwards from COVID to cancer, cancer has been there around us for so many years, and this 1 year of COVID, as a radiologist in a cancer hospital, I feel that many patients couldn't come. That has been a very, very sad story that many of my patients, I'm working in a government hospital where we get patients from mainly rural areas, not only from urban, but also rural areas. And some of them could not travel and could not come, and some of them are presenting with more serious cases than they would have otherwise. That is really something sad that COVID did for cancer. However, let us move on, let us move forward. I think we are trying to defeat COVID. Let us try to defeat cancer also. Now, just a few words on the common cancers that is affecting us, females, and that we see regularly in a government hospital are: number one, cancer of the breast. Now, it used to be a Western disease, but now we see a lot of cancer breast in urban women of India. So a lump, very commonly in the upper part of the breast, upper outer part of the breast near the axilla, is a common finding in breast cancers. So to defeat that and to be able to detect a breast lump at the earliest, that should be our goal. And for that, we as women, we should perform a monthly breast self-examination. Apart from that, annual physician checkup, a 1 to 2 yearly mammogram if available. That will be very good to be able to detect breast cancer early and to be able to defeat it, so that the earlier it is detected, the better its treatment, the better its prognosis. The second most common cancer affecting women here are the cervical cancers, and that is a more of a rural presentation, and that used to be commoner before. Slowly we've been able to tackle the disease, and we can see fewer cases coming here, but there's still large number of cases. And we early marriage, multiple sexual partners, poor hygiene, poor lifestyle, these are many of the causes that are causing these diseases. And for that, we advise a delayed, not anymore any teen pregnancy. We should go for safe sex. There should be cleanliness in our life. We should avoid smoking. We should have a healthy lifestyle. And if possible, if you have access to it, go for pap smears, go for screening camps, which are organized by hospitals like ours, the cancer hospitals. We do cancer screening camps. And in young girls, vaccines are an option, but it depends on the availability of where you are. But the most important thing is that you should go for regular checkups, you should have healthy lifestyle, and you should have a clean habits. You should develop clean habits. The third, cancer which is not that common in females, is related to the oral cavity and lip cancer. And for that also, it is advocated that you do a self-examination of your oral cavity if possible. Keep looking for any small ulcers. Keep looking for if you have any sharp teeth, and avoid chewing tobacco. That's a very common habit in a lot of females in our country. Chewing tobacco is very bad habit, so you should try to avoid it as much as possible. Maintain your dental hygiene. If possible, go for a dental examination, avoid spicy food, and again, a healthy lifestyle. So the fourth cancer, which I just want to point out, is the ovarian cancer. There is not much we can do about it. It often presents as a pelvic lump, a pain abdomen, abnormal menstrual bleeding, and loss of weight. That has to be checked up and found out by a doctor. So just a quick sum up of what we can do as the ABCDs of cancer care. For all of us, very simple things which we can avoid and which we can do is A, avoid alcohol and smoking. B, do a regular breast self-examination. C, go for cancer screening if it's available near your places. Diet, maintain a balanced diet with a lot of fruits and leafy vegetables. E, go for regular exercises, whatever you can do, even inside your house or outside if you have the facility to do it, a regular exercise. F, if you have a family history of an ovarian or a breast cancer in your family, you should be extra cautious and go for extra checkups. G, go for a gynecological checkup if one feels that you have some abnormality in your bleeding pattern, sudden changes, heavy bleeding, or a heaviness in the lower abdomen. And H, to sum up all of it, all of this constitutes healthy habits. We should inculcate healthy habits, avoid smoking, avoid alcohol, avoid spicy food, go for regular exercise, go for care oneself. If you need to go and visit a physician, maybe a surgeon, maybe a gynecologist, whatever be your problem. And the mantra is, on this Women's Day, take good care of your body and mind, and they will take care of you. Empower yourself, and get yourself free from not only cancer, but a number of diseases which are all linked to lifestyle. Thank you.